Welcome. In this video we will learn how to give deltoid muscle injection easily at home. Deltoid muscle injection is given into the deltoid muscle below the shoulder. This injection site is ideal for low-dose injections and vaccinations. But if the injection is too much, you need to choose another injection site such as dorsogluteal or ventrogluteal. Now let's see what we should have before injecting. We should have an injection first. This is our injection ampoule. This is a syringe. This is spirit for disinfection. And this is cotton. Let's prepare our injection first. Take the syringe. First you need to see if the syringe packing is opened or not. And if the packaging is open, then you should not use this syringe and take another packed one. Because we don't know what happened to this open syringe. Its packaging is not open, so we take the syringe out. Then tighten the needle a little, because sometimes it is not enough tightened. Now we have the syringe and start the injection filling process. We take the injection ampoule out of the packaging. This is our injection ampoule. First of all, we have to look at whether IM is written on it or not. If IM is written on it, then we can give it into the muscle. If it is not written, then we can't give it in the muscle. IM is written here, now we can give it in the muscle. So let's move on to the next step, which is about breaking the injection ampoule. Friends, it is very easy to break the injection ampoule, but we have to learn it even though it is easy. So let's learn to break the injection ampoule. For those who are new and have no idea about this, the simplest way is that when all the injection liquid lead is down, they will hit with any metal object from above and the ampoule will break from above. Let's learn the second and proper method. Friends, first you hold the ampoule in your left hand. As you are watching, I have injection ampoule in my left hands, thumb and index finger. Now look. My right hand is completely free. This is my index finger. Now I put my index finger below it and I'll grab it with my thumb. And now we break it. We will gradually increase the load on his neck to break it. We will not give sudden jerk. A sudden jerk can break it from the wrong place and injure our hand. Rather, we will gradually increase the pressure on its neck, which will bring a level that will break it. See how easily it broke. If it does not break even after applying pressure, break it with any metal object. We have break the injection ampoule. And take off the syringe cap and start filling the liquid. Friends, you have to do all this with confidence. It is very easy for an average person. You have to know and understand that you are doing. When we do any task slowly, there is a great chance of success even we do not have enough knowledge or experience about it. If we try to do with speed, there is a great chance of fail even we are an expert. Friends, we have filled all the liquid in syringe, there is nothing left. Please fill all the liquid. If we leave some liquid, it reduces its dosage. Keep the injection straight in front of you. Now we take the air out of it. First you pull the plunger to the back once, and then slowly start to blow the air out. If a bubble is stuck at the bottom, bring it up by tapping it with your nails. And turn the plunger upwards until all the air is gone. Now a drop of liquid has finally arrived, which means there is no more air in it. Friends, even if a small bubble left in syringe, there is nothing to worry about. You can give injection. Don't waste too much time and medicine in trying to get the bubble out. Now the filling process is complete and it is time to give the injection. But before giving, we can recap it once. So that the needle does not touch anything before giving. Place the injection cap on a smooth surface in front of you. Then insert the needle into the cap with great care and make sure that the needle does not touch any outer surface. Once the needle goes inside the cap, you can grab it by the hand and lift it up. Our injection was recapped. And now we give it. Friends, we will give the injection in deltoid muscle under the shoulder. Remember that injection should not be given over the clothes. Because there is a risk of infection when injected over a cloth. So we put the clothes off first. so that the arm is naked and without clothes in front of us. The arm is in front of us, so where the injection is given over there. So let us see an animation to know the safe deltoid muscle injection site. It is very easy to find the safe deltoid muscle injection site. First of all, you have to feel the bone on the shoulder, which is called acromion process, by touch with hand. You can easily feel this bone by touching it with your fingers. The acromion process is a landmark for finding the safe deltoid muscle injection site. Deltoid muscle is just below the acromion process, but we have to inject in the middle of the deltoid muscle. For that we have to know the middle part of it. The safe deltoid muscle injection site is usually 1 to 2 inches below the acromion process. The easiest way to locate this area is to place 3 fingers below the acromion process so that the safe deltoid muscle injection site will be immediately after the 3rd finger. To give an injection, you need to use a needle of 1 to 1.5 inches and give the injection at a depth of 90 degrees. Insert the needle completely so that the needle reaches the muscle. We have learned that in order to give an injection, we must first feel the acromion process bone above the shoulder by hand. We can easily feel the acromion process by hand. As we can see, this is the acromion process, and this is the end of it. We have felt the acromion process. Now we have to put the 3 fingers of our hand together and place them below the acromion process. We put 3 fingers. The safe injection site is right after the 3rd finger. Remember, we need to inject in the middle of the deltoid muscle. Now we disinfect the area before injecting. So for that we wet the cotton with spirits. And then we will rub round circular motion for a few seconds. And then let it dry. This will disinfect the area. Let's give an injection now. Hold the needle in your right hand as if you were holding a pen for writing. Now place his left hand on the shoulder like this. And hold the deltoid muscle in your hand. Now insert the needle with the right hand at a 90-degree angle to the skin. The entire needle is inserted so that the needle can reach the muscle, and by mistakenly we may not give injection in subcutaneous tissue. Aspiration pulling back the plunger is not recommended in this injection site. Inject slowly in a few seconds. After injection is complete, take out the needle at angle as inserted. Immediately place the cotton on the area so that no injection liquid or blood comes out. So friends, this is how deltoid muscle injection is given. Try to explain to you in an easy way. Hopefully your knowledge has increased. And you have learned the deltoid muscle injection technique. Please like the video. And for more informative videos you can also subscribe to the channel. Thank you very much for watching.